My name is Kendall Fults, and I've been with Adventist Health for a little over 30 years. And as I'm transitioning towards retirement, I'm actually working with the business development team working on projects for them. So from the foundation, it all came about when I received a flyer about that Bob Hope was doing galas or concerts for hospitals and other charitable organizations. And the whole concept in starting it was recognizing that it would be more costly for that level of entertainment. We wanted to establish an event that everyone in the community would look forward to doing each year. We always focused a presentation for the crowd of community people that were there to tell them about the hospital story or what those funds were going for. One time it was a cardiac cath lab, other times it was hospice, to make people aware that the whole event was circled around services that would improve in the community and to keep people involved with the facility that was there to serve them. So on the clinical side, some of the things that are very rewarding for me has been recruiting a physician in and seeing them do well in the community. Continued to be here for the last 20, 25 years, not only as a service to the community, but also the chance to become friends with a lot of the people that you've recruited and to see the improvement in our services and the growth. Coming here in 1986, we used to joke that there was more CT scanners in town than stoplights. There was 2 CT scanners, and I think down here on the corner of 11th and Lacey was probably our only stoplight at the time. So a lot of growth in the last 30 plus years. I'm really proud of the work our team's done on our rural health and really serving the underserved in our communities. We started our first clinic in the early 90s. I was asked to put a team together for that, and I think we're focusing on 700,000 visits this coming year. That's really a key part of our mission. Kind of, I think the threshold question is would you send your family there for those services? And I want to be able to look anyone in the eye and say, I'd send my family to this physician or this service that our hospital would be providing, and continuing to strive for better services, to continue to make a difference in patients' lives. I think that's really what we're about. One of the things that I believe is critical for a hospital like the one in Hanford in our network is that we understand what an important part of the local economy we play as a hospital, and supporting local business and contractors and others within our community for our needs at the hospital, but also how important it is for us to keep business at home so that people aren't out migrating for services, because when people leave the community, they take part of the economy with them. And being able to have quality healthcare here is critical for us to be able to keep that business at home that helps serve all of our different business entities. So I think I'd like to thank Adventist Health for giving me the opportunity to work in a faith-based organization. I think being able to pray with your patients, I think there's a spiritualness about healthcare that is missed if you're not in that type of an organization. And I've had a supportive family that's been there for me. Having a supportive wife, and certainly Allison has been that for me, and I appreciate her patience and being there to support me, and it means a lot to me, sweetheart. I just think all the employees, the staff, my teams, administration, foundation, the volunteers, that's what helps you be successful. If you think you do it yourself, you're wrong. It takes a whole team to accomplish the things that we've been able to do. And I don't take that lightly. Willard Bridwell recipients, the King's Health Foundation, that they would give me this award is humbling. And I thank them. Taking an award like that, it didn't happen because of just me. It's our team, it's the community, it's the foundation. I want people to know that. One of my sayings is get her done. I really think that taking action and moving things along and getting things resolved and done, I hope people look back and say there was a guy that could get it done.